In this week's Focus on Your Health, Teresa Snow shows us how doctors were able to help one man go from a wheelchair to the dance floor.
Focus on Your Health is sponsored by MU Healthcare.
Arthritis or joint inflammation can be painful and debilitating. For John Pierce, it was arthritis in both hips, keeping him from doing what he loves most. Much like John Travolta on those famed Saturday nights, John Pierce comes alive to disco.
It was like it was my calling. It was perfect. It was the music for me.
The 73-year-old spent much of the past 6 decades here on the dance floor until he was sidelined by severe arthritis in both hips.
I thought it was all over a couple of times.
Dr. Benjamin Hansen believed there was still hope for John.
He was in a lot of pain and confined to a wheelchair. He couldn't walk, and he just had the look of somebody that has just been worn out due to the pain.
The orthopedic surgeon at University of Missouri Healthcare performed a double hip replacement.
I think it bought him years of his life, honestly. He's now able to live a more full life, be more active, which is going to cause other health benefits down the road.
But for John, the real test was shaking his new hips on the dance floor. It didn't take much practice. Today, John is back to boogieing, and he says he'll keep disco dancing just as long as he's staying alive. Joining me now is John's doctor, Dr. Benjamin Hansen, an orthopedic surgeon with MU Healthcare. What a heartwarming story, a great story of his recovery. Give us a sense of what it was like before his double hip replacement.
Simply put, John was confined to a wheelchair. It was very difficult for him to move and get out of the chair to transfer to a bed or a chair. And he just didn't have much life in his eyes. It was really sad to see him that way.
Do you see this kind of dramatic improvement? Are his results typical?
The results are typical. I mean, people are able to get back to their desired activities very frequently at a very high rate. What's not typical is how far John's disease progressed before surgery. Most people don't wait until they're confined to a wheelchair before having the hip replacement done.
What kind of symptoms send them to a specialist like you?
Primarily pain in the hip region, pain with range of motion and weight bearing of walking.
He had both hips done. Is that typical? Would you do them one at a time or at the same time?
Usually one at a time. It's a major operation, a major surgical procedure, so I think it's safest to do it one at a time.
And he's back to dancing. Is that good rehab?
Excellent rehab, yeah. It's awesome to see him back to dancing. Having seen how far he's come, it's amazing.
It's a great story. Thank you very much, Dr. Hansen. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.